Hi, everyone, and welcome back to UCLA Health's Medically Speaking. I'm Dr. Eve Glazier. Many of us associate organ donation with loss, one life in exchange for another to continue. But there are also many stories that are about sharing life, when a healthy person chooses to donate an organ to someone in urgent need. Today's story is about exactly that, living kidney donation, and the extraordinary intersection where science, trust, and humanity meet. Joining me today are three people who have lived and are living this story from three very different places. First, we have Dr. Andrzej Rastogi, a nephrologist here at UCLA Health and the medical director of the Core Kidney Program, which is a comprehensive approach to kidney care, spanning prevention, treatment, and transplant. We're also joined by Nanette Zumwalt, who has lived with polycystic kidney disease for years before she received a life-changing kidney transplant. She's a passionate advocate for kidney health, bringing both her professional expertise and personal experience to advancing compassionate, community-based care, as she's also president and CEO of Hired Power, a leading concierge behavioral health and recovery support organization. And finally, Philip Palmer, longtime news anchor with ABC 7 Los Angeles, community leader and living kidney donor, who in 2007 donated a kidney to his friend Dale. And Philip's experience as a donor has inspired him to support others and raise awareness about kidney disease, connecting deeply with the work of Dr. Rastogi. Thank you all for being here. I'm deeply honored to have this conversation with you.
It's a pleasure to be here.
Thank you for having us.
Thank you so much. Andrzej, let's just start with some basics. And for those who haven't listened to it already, Andrzej did join this podcast before talking about the basics of the kidneys. But why don't we start out this conversation? Remind us what the kidneys are, what they do.
So we have two kidneys, and they're in the back, right below your ribs. And I do want to stress we have two of them, so we'll come back to
that. Next question.
Because at least one of the people here has this one kidney, so we'll talk. It's a complex organ that, among other things, purifies blood, and it comes out as urine, those waste products. But it does a lot more than that. It's what we call an endocrine organ. It's involved in hemoglobin, the red blood cell production, vitamin D activation, blood pressure regulation, and a lot of other metabolic factors. So it's a very important, vital meaning that you can't live without it.
Mm-hmm. But as you sort of hinted, maybe we don't need to live with two. And I think that surprises a lot of people that you can live with just one kidney and live well. So I guess just backing up, why do we even have two kidneys to start with?
So that's nature's question, in my opinion. But we in our system, as you know, in physiology, we have a lot of redundancy. We have extra things that are backups. So I do want to say that you can live with one organ if you're healthy. Mm-hmm. You know, that's a key thing. If you're unhealthy, then you really need both of your organs.
So helpful. And so for people who don't know a lot about kidney disease, why don't we just start with why kidney failure, or if the kidneys aren't working well, why is that so life-threatening, and why do we have to do something about that?
Yeah, so I think I'm glad you asked that, because it's, first of all, kidney disease in majority of patients is asymptomatic.
Mm-hmm. Meaning no symptoms.
No symptoms. Right. They don't feel anything. Actually, it's maladaptive. They feel things, but it's so slowly progressive that your body maladjusts to it. Right. But the other important things are 1 in 3 are at risk, and I've said that before. 1 in 3 adults are at risk, and we can see number of people in this room, right? 1 in 7 have kidney disease, but only 1 in 10 know it. So 9 out of 10 people who have kidney disease do not know they have kidney disease. And this is even people who have advanced kidney disease. These are people who are going on dialysis, and they walk into my room and say, well, why are you telling me dialysis? I feel just fine. Right. So testing. I think that's really the key thing.
Right. And we talked about that a lot too, which was the screening, so in the absence of having kind of overt or, really blatant symptoms, we talked about coming to me. I'm a primary care provider for you, Nanette, and Philip. It was about getting screening tests, having a urine analysis done every year, and really kind of even just the awareness about kidney disease in the first place. But so just knowing this, though, that you can donate a kidney if you're healthy, that reality alone makes living donation possible. I think that there's a lot of confusion, and I'm so glad that the three of you are here today. And I do want to just sort of ask very briefly before we kind of start and hear the stories from both of you. What do you want people to understand quickly with what it's like to live with one kidney and why that's possible?
Yeah, so, well, there are there are patients who have just one kidney and they don't know
to start with.
They start
Yes.
with.
They don't born that way.
But if you're healthy, and we'll be going over some of those factors as well, then you can live a healthy life
Great.
with one kidney. The important thing is that you maintain that healthy lifestyle post-donation as well. And I think that's a very important thing that people need to know.
Okay, great. Well, and we'll definitely get into that. Nanette, maybe we could start with you. You lived with polycystic kidney disease. This is a genetic condition that, and I saw you nodding, can quietly progress for years. Could you take us back when you first kind of learned that you had polycystic kidney disease or PKD?
Sure. Well, I was aware of polycystic kidneys as a child. My grandfather, my uncle, my mother all suffered with polycystic kidney disease. So it wasn't a general topic because back then it wasn't a general topic. So we knew my grandfather went to the hospital. We knew my uncle got a kidney transplant, but we didn't really put any weight in that. It wasn't really discussed as a family. It was something that just happened. So it wasn't really till my mother got very sick that the doctor said, you should all get tested. And it was, we were in our teens.
So a pattern wasn't even kind of discussed before then or noticed?
No.
Oh, interesting.
No one, it wasn't talked about. It wasn't discussed. It wasn't acknowledged as a genetic disorder until my mother got very sick. And my youngest sister was the first one identified with polycystic kidney disease. And it went right along the lines of 50-50. Each egg has a 50-50 chance genetically. And out of 4 children, 2 of us did and 2 of us didn't.
Can you tell us what it was like kind of I guess when your sister got diagnosed or how you got kind of diagnosed or what were your first symptoms? I mean, it sounds like they were slow and kind of slow to progress, but what you first noticed or what it was like to kind of live with that, knowing that your mom had it as well?
It was really living with the knowledge because when I was first diagnosed, I went to be tested, the urine and the blood test, because my mother's doctor instructed us to, but I didn't have any symptoms at that time. So it really, again, I was an adolescent.
So what did you think of? Like, was it just so abstract?
Yeah. It didn't really mean much.
Yes.
And we got the lecture of the genetics. And so it wasn't really till my mother got sick and was facing dialysis. And again, never an option of transplant, never discussion of transplant, even though her father and her brother were transplanted, which is such a weird family system experience that I hear happens more and more. Like someone else in the family could have a transplant, yet this person is now facing it and has no knowledge.
So for her, it was a knowledge thing of not having a transplant accessible to her?
Yeah, just not being offered, just being told to go directly to dialysis. And so she never went through that transplant process.
Andre, maybe I could try to ask you just to chime in here and kind of just explain to our audience, what dialysis here kind of versus transplant, if you don't mind.
Right, absolutely. So dialysis is a machine. I mean, dialysis is actually a biochemical procedure, but it dialyzes your blood. That's where the term dialysis comes from. And, it is a life-saving measure. I want to put it out there. And there are a lot of patients. There are more than 500,000 adults in the U.S. who are on dialysis. And it serves a purpose. But at the same time, a lot of people think that dialysis is a replacement of your kidneys. It's not. All the function that I mentioned the kidneys do, it does only one of them, and that just gets rid of the waste products from the liver. And that too, the amount of dialysis we provide or can provide replaces only 10 to 15% of what the kidneys do for just for purification. The other function it cannot do. So it's stress on the body. You can go for in-center 3 times a week. You can do it home, and that's at UCLA. We've set up a very big home dialysis program. But at the same time, it's a stress and burden. And for me and at UCLA Health, it's if we can get a preemptive transplant, that means bypass dialysis completely. But at the same time, I will see dialysis as a bridge if they have to go on dialysis to transplant. Your ultimate goal, if you can, is to get a transplant.
Okay. And I mean, you did mention preemptive transplant, and it sounds like I'd love to hear kind of how you got to a preemptive transplant. But maybe we should explain, right? I mean, sometimes a transplant is preemptive, which sounds like what it is, but I'd love to know how you kind of progressed to the preemptive transplant. So were you ever on dialysis then?
I was not.
Okay.
By the grace of God. And like Dr. Rastogi said, I don't look down at dialysis.
Yes.
A lot of people are saved by dialysis.
For sure.
I don't want to discourage that or make that be something that isn't positive. But for me, a preemptive transplant is really what we wanted. My husband is the one that took a very proactive research and found Dr. Rastogi at UCLA about 15 years ago.
Okay, good. I did want this origin story. I'm so glad to finally hear it.
So I entered into a research study for tolvaptan. My sister and I both entered in and got to know Dr. Rastogi, and that's how we got connected with CORE and UCLA and have been big advocates since then.
So where were you in kind of the kidney journey when you met Dr. Rastogi? Like, were you having symptoms of the polycystic kidney disease at the time? Where were you kind of symptomatically or not when you met him?
Sure. So high blood pressure.
High blood pressure was the symptom.
Since a teenage year. And then pain, flank pain. I was an athlete. I was a high school athlete. I was a college athlete. So, of course, I was encouraged not to play sports, which I don't think, depending on the contact sports, I don't really discourage that anymore. But so I was very aware of the disease around the pain and the high blood pressure, but didn't have, I was running 100 miles an hour as a college athlete. I was, and then I started a company and became a mom. And so, you, like Dr. Rastogi said, as your kidney function goes down, you just adapt. So I wasn't cognizant of how exhausted. I thought everyone was exhausted.
Right. You're like, I'm a mom. I'm working. Right.
Yeah. In America, we all run exhausted.
Right.
Right. So that was normal. And then, I got to the age of menopause and I was like, well, it's this, well, it's that. So it was always, I thought, something other than my kidney disease.
And so at what point did kind of transplant become part of the conversation for you?
I think we came into UCLA research
thinking
knowing, my mother had already passed at that point, knowing that was the lane we wanted to go in, but obviously looking for how to postpone that through research study, through medication, through Dr. Rastogi and his team's support and guidance. So transplant was always the way we wanted to go, and it was always preemptive, meaning before dialysis.
Yes.
But it came faster than I wanted it to.
Oh, yeah. You mean needing it?
Yes.
Yes, needing it. I mean, and so, let's just go right into, your transplant story, which is amazing. Just this story of fate and family is just incredible. From what I know about it, and I want you to tell all of us, your transplant story really was very unpredictable. Can you tell us about, a family trip to Barcelona that ended up kind of changing the course of your life?
Sure. Even before I knew I needed I was still outrunning my transplant at that point. And
literally,
my younger son had graduated from UCLA and was going to do a boys' trip to Europe, which is kind of a big thing they do. And so my youngest daughter and I went along and said, we'll go the first couple weeks and then you can go with your boys. And so I wanted to go to Budapest and Prague, and they wanted to go to Barcelona. So we landed in Barcelona, and the first night we went out, my son met this young girl, very sweet young girl. And the first thing she says to me is, I know you. And that's what I said. I go, no, honey, you don't know me. I just got here. And she said, no, I know you. You're in my dreams, and we walk on the beach. Wow. And then I went, that's what I said. Okay, you met my son in a bar. And, so you're thinking all these crazy things, right? And she stuck with that. I've known you. I've always known you. And she stuck with that. And then 7 years later, she's in the U.S. Her and my son are married. I need a kidney transplant. And she says, my mother is your match. And I said, well, does your mother want to be my match? And she said, yes. And she's your match. And so we got connected with Dr. Rastogi, and she got tested, and lo and behold, she was my perfect match.
That is incredible.
It is.
It is goosebumps everywhere. Even saying this every time. Yeah. Can you believe it?
No. It's like, if you don't believe that there's a power greater than that.
How do you tell that without crying?
I know.
I don't very well.
Yeah.
Yeah. So, and just that she knew.
You rush through it, as I know that.
Yeah. So, the fact that this, woman from across the world is my perfect match. And 7 years earlier, we happened to meet her daughter, who says she's always known me. And here I am with her mother's kidney, by the grace of God, having a good life.
Oh my gosh, that's just incredible.
And she never faltered. My donor.
I was going to ask you.
I know Philip's going to be able to share that, but first for me it was a very difficult ask. How do you ask someone for? It's not like, hey, will you cut your hair, or could you give me a pint of your blood? It was like, hi, can I have your organ? It was, and I had a very difficult time asking. I actually forbid my family to put it on social media. I am an employer. I was responsible for a lot of people's paychecks. I was very concerned that if people knew I was sick, that would change their response to utilizing our services. And so there was a lot kind of in my head that was at stake with being known I was sick, aside from the fact of not wanting to be seen as vulnerable.
Were those the things that went into, though, how difficult it was to ask her, or is this just on top of it?
Ask it all.
Yes.
Yeah.
Just ask it all.
Ask it all. And so it wasn't until one of the core kidney members, I'm like, my family can't put it on Instagram, and I'm not talking to my best friends if they tell people. And he just looked at me and goes, you need to get over yourself if you want to live.
Andre said this?
No, one of the core kidney members.
One of the core, yeah.
And my husband tried to say that, and Dr. Stogie, very respectfully, as my physician, tried to say that. But it wasn't until another recipient who had gone through the journey was like, what are you talking about? Like, you have to ask. You have to talk about it. And this is where... And it was just really hard to do. Yeah. And then so when she came, I kept thinking, she's going to change her mind, or, this isn't going to... It's not going to happen.
What's your donor's name?
Diana.
I mean,
she's an angel.
Of course.
An angel. I mean, they really are like earth angels. Like,
I mean, if you could go back and tell yourself something different, what would you tell yourself? In terms of trying to get over. And I'm always saying that for people who might be in your place now and who don't want to ask for that help. Like, what would you say? Whatever.
What I would say, being that I'm a person, my family's always been in service and law enforcement, medical, social service. So, is that if I couldn't do it for myself, I need to do it for those who need to hear it, right? Because I could have done it for someone else, but at that time it was like, how do you ask someone, it was just a really hard, and bottom line is I was afraid.
Yeah.
I was very, very afraid.
Afraid of all of it?
Of all of it.
Yeah.
Yeah. Of actually needing the transplant, of actually acknowledging that I needed, of actually asking for it, and then what would life look like after? What kind of quality of life was I going to have? And if I only knew, now I'd be like, run, girl.
Well, that's why it's so helpful. I mean, that's why I'm so grateful you're talking to us. I mean, because people are listening, and I think that's what's so helpful. And even if it's your younger self.
Yeah.
I mean, so much too. I mean, and I think we all, there's the miracle that is obviously Diana, right? Yeah. And then, but also just how grateful we are to have the Core Kidney Program. And maybe we could kind of get a little bit of information before, Philip, I get your story, which is how lucky we are, right? When we find the right care and the care team. So it seems like a good moment to kind of get introduced to the Core Kidney Program. If you could tell us a little bit about it.
Yes, please. There isn't anything out there like Core.
Yes.
I mean, I work in healthcare. I work with providers across the country. My company goes national. There's nothing like Core that does the research, the education, the advocacy, that has people like Philip committed to the cause, who continue to show up to talk to someone else who's might possibly be a donor, or myself talking to another patient who has to go through, where we've been. There's just nothing like Core. It's so special.
It is so special.
So special.
I'd love to hear was Core already existed when you and Annette met?
It exists. It was pre-Core.
Okay.
I would say, because the
he always operated
right
in
that.
Yeah, that's the right
in that framework and approach.
It was always his philosophy.
Yeah, and Christina and I, and she was one of the founding members of Core, along with Philip. And the whole idea of Core, it stands for clinical excellence, with that C, because I always say the patients, you can do all the research and education. What matters to her and her family is the care that she gets. And she's going to talk about her care at UCLA Health. She lives in Orange County, which I don't think you mentioned.
No.
She drives all the way from there for all her care. She has a very deep connection with UCLA. Beyond Core, her kids went to, played football and national, So, but the whole idea of Core, which outreach, research, and education, is about patient support. And very early on, and I was born and raised in India, this place called Jaipur. I was just there, and when I came here, right after medical school, one thing that occurred to me is it's always reactive than proactive, right?
Medicine. Yes, often.
And fragmented care, right? And then the support system. And I also always say that I know about kidney disease. I know about PKD. I know about, dialysis and transplant, but I'm not on dialysis or transplant. I still remember our first kidney fair that we did at Santa Monica Beach. There was a guy who flew in with PKD, flew in from Australia. And I said, and he came to me afterward and he says, I've spoken to all physicians, but the biggest support that I've gotten is speaking to other PKD patients, that I will be okay. And that was a genesis. And things have grown quite exponentially. And I'm very grateful to people, leadership, our UCLA Health leadership, Dr. Mazziota, and Johnese especially. I mean, you guys have been so supportive. So CORE is doing well. We are trying to do a lot more, but it would not be possible without a healthcare system like UCLA Health.
And Johnese and Dr. Mazziota, who are very, very supportive and involved.
Yes.
Involved.
How
so
often
involved.
you have an event and there's the CEO and there's Dr. The fact that they show up and are interested and supported is very, very special.
No, it's really emblematic of, this patient-centered care. And, you're talking about patient support. Yeah. I'm hearing you, Nanette, talk a lot about, it sounds like there was support for your family, too. I mean, if you could expand on that a little bit. But, it sounds like your husband is even the one that even identified, Andre in the first place.
Yes, I have a very proactive husband who did not let me remain with my head in the sand.
Good.
But it really was the core members. Brian Gillum, who is one of our lead ambassadors, he was the first to have a conversation. My husband called him. They met for coffee. And, because we're high school sweethearts.
Yeah. Oh.
So, when I got sick, he was like...
Well, your family too, right?
Yeah.
Yes, he's been part of all of it.
Yes. Yeah.
Brian walking him through was so powerful for him then to help me.
Yes.
Because I needed him to guide me and push me.
Yes.
There's not a lot of people that can push me. I'm kind of stubborn. But to have him, but also have other members of CORE could push me in a way that my husband or my physician or my sister couldn't.
Yeah, it's really the beauty of this multidisciplinary team that you've that you've grown. And again, talking to people, I think, and meeting them where they are. Philip, I really, Andre has described this incredible program, and Nanette, I'm still getting over everything that you've shared just about Diana and receiving this. I have so much more to ask you. I do want to ask you, Philip, you've been living inside this, system that has been set up, and years before you ever donated a kidney, you can tell me, but my impression is that you heard a story about an athlete.
Oh, yeah.
Alonzo Mourning, and that transplant made, his life possible for him. I'm curious, what was the moment for you that planted a seed about donating your own kidney?
Well, yeah, it was, and this is, I think, one of the reasons why it's important to be a part of CORE. It's because you never know what words will ring true with someone, what effect you might have. I always liken it to a pebble in the water. You throw it in there and you don't know the ripple effect. I have since met Rick Riley, the guy who wrote the article in Sports Illustrated, and played golf with him and told him he saved a guy's life that he didn't know.
Just by writing a story?
Yeah. And I can still picture the room where I read the article, you talk about the emotion. I called my mom and I said, Mom, this is kind of crazy, and I prayed about it, and my prayer was not that a friend would get sick, but I said, God, I know how I am, that I get inspired to do something and then I forget about it. And I said, I just don't want to forget about this. And I bring up my mom because
moms rock.
Well, that's the one that gets me emotionally, because when this all happened and Dale got sick, I called my mom and I was like, okay, this is going to be a tough conversation because she's not gonna like this. And she was like, okay. And I went, wow, okay, well, all right, good. And I said, I got to admit, I'm a little surprised that you're just all on board. And she said, don't you remember the phone call? And I went, I said, no. And she said, you called me. And she said, if you prayed about this, who am I to say no? And I was like, okay, well, here we go. I will say, I've talked to Anjay about this. I said, I do think the transplant coordinators need to come up with different language, though, because when they called me and said, you're the most negative, and I said, well, I said, I do know I'm most negative, and I was kind of bummed that I wasn't going to be the one to do it.
That's the highest compliment in medicine.
And she goes, well, what do you want to do? And I'm like, well, you just told me I was the most negative. I'm not going to do it. And she goes, no, that means
on the can. I'm like, oh,
okay, well, let's go. But yeah, so I had written an article. I read an article, and I didn't forget about it. And I will say that when I was listening to that story, and I would say to anybody that's listening, it is so incredibly common for the person who is sick to foxhole themselves, to pull the blanket over their head and say, I'm going to do this on my own, and I'm not going to ask for help. And Dale didn't even call me. I found out, gosh, all this gets really so crazy. But my friend Rob Fukuzaki also works at Channel 7, and he's the one that called me. And I remember I was in my truck driving along, and he says, Dale's in the hospital. And I'm like, what do you mean? Because Dale said the same thing you said. After the fact, he says, I just never understood how we could all go play flag football and everybody wanted to go do something, and I just wanted to go home and go to sleep. And so yeah, he would do the same thing, just adjust
and normalize it.
Yeah, and Rob called me up and said he's in the hospital. He was having these headaches. So I called him up, and he goes, yeah, I need a kidney transplant.
Just like that.
Yeah, and apparently he was about to have a stroke.
Oh my gosh.
And it was an eye doctor that figured it out, that said, you've got to go to the hospital. But I said, well, it's going to be me. and he goes, what do you mean? I said, where do I go? And he goes, no, just don't worry about it. I'm going to figure this out. And I said, Dale, this is going to be me. I know it's going to be me. I'm ready. And so he goes, well, you can go get tested and go to St. Vincent's. This is where you go. And we weren't even the same blood type. And yet I ended up being enough of a match, thankfully, due to the medicines and everything that you can take. We were able to do it. And I always say that I got a lot more than he did, because I got to help a friend.
I mean, it's just incredible. I mean, I think people describe donors as selfless, which obviously is true, but I mean, it just seems like the experience is myriad, details even more. I mean, it's just incredible. And this was by no means impulsive. I mean, it just is amazing, that story of you calling your mom.
Years and I still get
for sure.
That's how powerful it is.
It really is, yeah, because it's everyday purpose, and you're connect to it every single time.
Well, but understand, there's 7,000 people just like me every year that are living donors, and I will to our point about talking about it, and one of the things about CORE that's so important. When I donated, there was another person who had donated roughly the same time, Sarah Faden. She's an LAPD officer who had given to her husband. And her and I met through different organizations in this wonderful opportunity. And she told me one time, because, at some point I just... it's so nice that Anjay and the net think of this, think of me in certain ways, but it becomes, it's like, I told Dale one day, I said, you've got to stop calling me and saying thank you every day. I said, we didn't talk every day. So I said, I'm glad we were able to do this, but, say bad things about me on occasion, because you used to. But Sarah told me one time, she goes, you have to talk. She goes, and I have to talk. She goes, because nobody knows.
Yes.
Says, you look at her and you look at me, nobody knows I did anything. You can't tell. She goes, so where's anybody going to come from? How's anybody going to know it's okay? How does anybody know this is a doable thing if you don't tell your story? Right. And that much like you talk about with people at CORE who will tell you things and would tell me things. And then I can tell, I like to talk to people who are donors about what they will expect after surgery.
Right.
And who do they turn to if we're not willing to tell our story?
Right.
So that's Sarah was a very powerful voice for me to say, hey, you got to stop it, and you got to be willing to talk about it.
What other questions come up like during the story? I mean, do people have questions about, you obviously felt like felt very resolved, to do this. Did you have any, misgivings or concerns or fears or friends or family?
Faith was a very big thing for me, and it was a prayerful experience. That's not the way that's not for everybody, but it was mine. And there was. It wasn't like I was going to back out, but the girl who's now my wife was my fiance at the time, and
great girl.
I was she's pretty cool.
Yeah.
We were sitting in the hospital. And I had already gotten the IV, and I was sitting there, and Dale was in the hospital room. They had the curtain between us just on the other side. And he was in there with Rob Fukuzaki. And this one always is really hard. Now, you guys have heard this one. But I got scared a little bit at that point. I was like, woof, here it comes. And I told my wife, I said, I need a prayer. And so we kind of held hands a little bit, and I just asked God for some strength. I said, just a little strength to get through this. And it was right in that moment that on the other side of that curtain, I heard Dale and Rob start to laugh. And they were just laughing. And I opened my eyes, and I looked at her, and I said,
there's your message.
I'm ready. And because that's why we do this. The reason I do it is so that he could watch his daughter get married, and now he's a granddad. You needed help, and you found somebody to help, and she wanted what she wanted for you, but it's just an opportunity to provide some normalcy, because we talked about dialysis. And Dale was lucky enough to only temporarily be on dialysis because we were able to very quickly get through the process and get to the donation. And as Anjay said, dialysis, while it's life-saving, is brutal on the body. The living donor element also makes for a more successful transplant, because while deceased donors are also angels, just transplanting a viable living organ is just generally more successful. And it's just I didn't want Dale on the machine. The machine would have saved him. It did save him. It gave us that bridge. But that was one of the things for me. And so for that little prayer to be answered in that moment, with that laughter on the other side of that curtain, I was ready. It was like,
so he could keep laughing.
I remember that pre-surgery. I had a similar, but again, being in that stage of denial, right? I was washed. I was gowned up. Dr. Stogi's on one side. My
this is on the transplant
there.
day.
Yeah.
Yes.
And I'm laying in the bed, and these two nurses come in, and they've got their scrubs on and their hats, and they say, "What music do you want playing in the OR?" And I looked at them and I go, "The OR?" And they said, "Yes, what music?" And I go, "What do you mean OR?" And the doctor went, and I was out. But I mean, here I am, gowned up, laying. Dr. Stogi's there, the anesthesiologist is there. And I'm like, what do you mean OR? So
I will say, to your point, I think too, some of the things that we do need to share in Marcyr. Now, those are our stories of operating days. I think one of the things that's always funny to me is how 1 minute you're awake and the next minute it's like 8 hours later and you're awake.
And I woke up feeling like a champ, like I could run.
Well, and that's the funny thing. She wakes up feeling great, and I felt like I was in a car wreck. So it is a slightly different experience. However, the questions that people ask, and this is one of the reasons CORE is so great, it's like from the patient experience, from the transplant recipient from the donor. You know, for me, one of the things I would tell people is like, hey, walking is your friend. Avoid sudden motions. And some of that, God bless the doctors, because they have dedicated a life to getting us healthy. But they don't know post-operative. I felt good enough that when I went back for one of my follow-ups, the doctor asked me, so how do you feel? And I said, oh, fine, I'm already back. I'm back in the gym. I'm doing this, I'm doing that. And he goes, wait, stop. And he said, no, you could get a hernia. And I'm like, maybe you should have told me that. Because I felt good enough that I thought I could go back to the gym and start, you bloat, when you have one of those surgeries. I felt like, well, I got to get the abs back, I'm getting married. So, I tell people, I said, hey, take it easy on this and try not to do that and make sure you're doing these things.
Diana, mine was during quarantine, so we were our quarantine pod, as they used to call it. So it was Christmas.
The bubble.
Yeah, the bubble. It was Christmas Day, and I was home for 2 days from the hospital, and Diana and my son and daughter-in-law come over, and Diana's in jeans and a belt. And I looked at her and I go, what are you doing? I can't even wear underwear. And she's like, I'm good. And I go, are you taking pain meds? And she said, Tylenol. And she was cooking dinner. And I'm like, okay. So, and again, I know it is much harder for the donor because I started
apparently
at 10.
Not Diana.
Yeah. Well, I started at 10% and woke up at, over 50. They start at 100 and wake up in half, so their body has to catch up. But even that, it was like I just was looking at her like, what are you talking? That's amazing.
When I knew my family was fine, because your family gets really worried.
Yes.
When my sister came, my mom came, my now wife was all doting and everything. I guess I had a surgery on a Wednesday, and then I was out of the hospital, and then I think it was the following Monday. I think, once I was out, and I realized they didn't get off the couch because Dancing with the Stars was on, and they let me go to the kitchen and make my own soda or whatever. And I quite literally was in the kitchen going, they think I'm okay now.
Yeah, you're like, I don't need a kidney here.
So, but it was Dancing with the Stars. It was Monday night, and they were all like, okay, he's fine. He can get his own food.
Well, and even this summer, Diana and I were comparing scars. I
already.
Yeah, I mean, I have a pretty small scar considering what my uncle had, this big, huge, around the back, big curved J thing. And I have, this small little scar. But she has like a little 3-inch scar that, is covered by her bathing suit bottom.
Right.
But we were, comparing like how crazy that these little things saved a life. Like,
and that's something that people need to understand is the advancements of the donation process. For me, for you, for the recipients. Right now, many people might not know this if they need a transplant. They often don't take the kidney out. They just simply stack them right on top of there. So she has 3. It's just a faster process, and
easier process.
Yeah, I think it'd be surprised a lot of people to know that you were home after 2 days.
Yes, and I was doing well. Yes. And I was, my doctor said you need to walk 10 minutes out and 10 minutes back from day 1. Yes. They get you up the day of surgery and have you walking, and it's like you said, to move that air, to move that bloating. And I was walking by the end of the month, and my doctor's like, I was walking, up to 5 miles, but I felt really good.
Yeah. Did that surprise you how good you felt?
Yes, because I didn't know how bad I felt.
Exactly. Yeah. It's just,
I do look back.
So used to it.
Yeah, I had lunch with another recipient on Sunday, a friend of ours, Chantel, another core member who was in another system, and we convinced her to come over to UCLA because she was waiting, and we were talking about, like I said, I remember being on the floor of my office in the afternoon thinking, how am I going to get to my car? This was at the end. And I knew I couldn't call my husband because that was it. I wouldn't be allowed back to the office. It would have been the end of going to the office, right? So the reality was of being where I didn't even, my body just kept up to where it could no longer keep up, and then all of a sudden I woke up and I'm like, I'm ready. Let's go. And it has, it was 3 years, December 20th.
So
and
great.
If I didn't take meds twice a day, I forget I'm a transplant patient. I forget. you know. And when I get a little tired and I'm like, I'm tired, my husband's like, right, you know. But what a miracle, what a blessing that I get to live this full life.
Yeah, the everyday blessing.
On the gift of, and you can say I can quit calling you an angel, but I never will, because I live on the gift of someone, you know, very much like Philip, who just had that passion, and you know, I get to live it every day.
I'm so glad. I mean, and it's true. I mean, the Core Kidney Program too. I mean, I hear both of you sound like you have wonderful families, you know, and I hear that in the support system. I also am always impressed by the Core Kidney Program because it's this infrastructure of a system support, right? To kind of get you through it, right? It's like your health family. I mean, where do you feel like the Core really kind of supported, you know, Nanette and you know, patients like Dale and you know, but both recipients and donors to kind of get through these processes. I think they sound very, when you describe them, it just sounds it sounds doable. I think for a lot of people listening, I think it still sounds pretty just miraculous and incredible, and it is those things, but it's also really doable. And I do feel like Core is kind of that piece.
And it's not a miracle that everyone can't have. Right. It's not like, oh, she got that, but I won't get that. Right. It is a miracle that everyone.
But you have to, the thing is, you have to be willing to let somebody help you.
Yeah.
I mean, that's the thing. If you're not going to ask, and that's why Core is so important. And I don't mean to jump in for Anjay, but that's somebody that you can call.
Yes. Yeah.
When maybe you're uncomfortable calling a family member, you know, you can call and say, what do I say? How do I do this? Maybe you don't want to post it on social media. There's health things that I have that I'm not quite ready to just start talking about, but I want, you can call somebody and they have answers for you.
And support. You know, because not everyone has a blessed family. You know, we have Core members that came to us because they didn't. You know, one of the things when you're looking for a transplant to
qualify for the list is you have to have providers who are committed to being there with you post surgery. And we have had Core members that came to us because they didn't have those people. And so they came to Core to help build a
so you really joined a community.
Yes. It is a community that we're building, and it's his. It is. I want to say it's his brainchild, but it's really his heart child.
Kidney child.
It's his heart child.
But I do want to say a few things, and I just want to go. I'll start with Philip, who obviously everybody knows how much I admire him as a human being and a gift that keeps giving. But I want to go back to your mother. You know, I was raised by my grandmother, and I get very emotional when I talk about her because she raised me, and she was not surprised. And we know why she wasn't not surprised, and because she raised you, and what a wonderful human being she has raised. So let me tell you about Philip a bit, because I think I've met a lot of wonderful people. You know, I'm surrounded by a lot of but there are very few people like him. And the reason I would say that is because, and I've said that at our galas, at our events, every time I speak to him, I say, you know what, I can be a better human being.
It's a lot.
Always. No, this is, and you know, it was something that came very naturally, you know, because that's the way you were raised by your mother. But also, he's always there. Today, he had to go to, he's at work. He has his daughter's high school, but this was an important thing to get the word out. He's going to share his journey that other people feel comfortable. Right? And I do want to point out, you know, Nanette's husband, Rick, who's also a very dear friend of mine. And he has his own story that hopefully we'll cover one day in one of these. But he applied to be a donor.
Yeah.
And he went through a very rigorous, screening. And at the end, he was declined. So the point that I want to make is that we are very careful, especially at UCLA Health, who we accept. It cannot be at the risk of the donor. And if we see that there's any risk to the donor, we decline them. Rick was not happy, and Rick is an ex-football player, and you want to mess with him, you know. And my conversation with him was that, unfortunately, you're not a donor, and
he was ready to fight. You're taking my kidney.
It was tough. So I do want to point that out, that there is. But going back to people like Philip and Diane, and what they're doing is priceless, and we call them angels. A donor, and I've said that, and I'll say that again. When you give a kidney, you know, you are not just helping a person, you're not just helping the family, you're helping society. We have a member who's a CEO of a very influential mental health company. This is what we give. So a donor does a lot more than just a kidney. They change society, and I think that's really important. So that's why we had the Rose Parade float. The first one, A Gift of Life, the tune that never fades, and both Philip and
we got our princess wave down.
Oh, I'm so jealous. Turn the light bulb.
So I think it's really important about awareness, and I do want one thing that both Philip and Nanette said is, if you don't ask, you don't get. That's as simple as that. So when a core kidney member called Nanette and said, "Get out of it," that you need to share, floodgates opened. I mean, there were so many calls UCLA Health was getting that we couldn't keep up with that.
Yeah.
So what Philip is doing, getting the word out, making feel more comfortable.
Right.
So you have to have a provider that strongly believes in that, because this is
knowledge about it.
Has knowledge about that.
A lot of nephrologists are not talking about transplant.
They and that's something, and that's where I think, look at
Yes.
Philip. I mean, he is a kidney donor.
Right, but like Philip said, I mean, there's 7,000 other people, right, in a year in the United States
and there's
or worldwide.
Just the United States.
Right, but every time you talk about it, right, that's what's generating that number to grow,
Because
right?
there's 100,000 people waiting.
Yeah.
And that's just living.
Yeah.
Just living donors.
Yeah, because the families of those and those that pass, we focus on living donor and preemptive because that's where we want the future to be. But there's a lot of families that are angels and giving their loved ones
Very much so.
In many ways, and so I don't want to minimize their their miracles that they're providing every day as well.
And that's something, I work a lot with Donate Life, One Legacy, and, we've always had that conversation. And that's one of the conversations also with this is you don't want to have to make the decision about whether you do or don't want to be a donor when the emotional moment comes. You want to have already made that decision. And I think that is one blessing that I had when Dale got sick. I didn't have to think about it. I'd already made up my mind, and I'd already become a donor, whether it was whether it was post-mortem or whether it was living. I knew I was going to do it. And I've always said that with organ donation in general. Talk to your family, let them know, because yes, 7,000 living donors, but exponentially more who have got the pink dot, so you're saving lives always.
Like have the conversation with yourself and your family.
With yourself and your family, 100%. Yeah.
It's important that your family knows what your wishes are, because I've talked to many family members who said they wouldn't have donated their loved one, but they knew it was what their loved one wanted, so they did it out of respect. And that has to be the hardest decision when you're in the middle of such grief and loss. I mean, I really applaud them to be able to do that.
I love hearing, how you mentioned the core team member, though, they helped you ask for help, right? Because it's hard, especially if you don't feel well, even if you've normalized not feeling well or emotions run high, to ask for help, no matter what. But to have someone then help you ask for help is its own,
And the caregivers.
Yes.
I mean, it's so important to acknowledge the caregivers. Your caregiver was your husband, Rick, right? But they are the true angels as well.
Yeah.
And I think we don't do enough to recognize them. And that was also the part of the float that we did, is the caregivers walking and riding on the float as well. But I also want to give a message to our audience who are, who has a loved member who's on dialysis or getting close. So preemptive transplant, which means that the normal process is, you should know your kidney function. Once your GFR, which is a filtration rate, every kidney patient should know that number. Once it falls 20 or below, then you can be evaluated by a transplant program and get listed. And once you're listed, then you can get a living donor evaluated. But the process should start much earlier, right? Because, and I do want to say, Philip, as the way you approach, the transplant or approach it when you're giving, you had decided, and whatever it took, you had done that. What we have to keep in mind, it is a process. It is a major surgery, right? It is, you have to go through testing and stuff. But the key thing is, what I was a medical director of the Living Donor Program for 10 plus years. I've spoken to a lot of donors, and it's the purpose of life, right? it's what it means to the donor. We all talk about what it means to the recipient, right? And it does, but it is a very special feeling. And once you've gone through it, they will say, would do it again if we have to. I've never seen, or very rarely.
Well, I'm not gonna. I mean, it would be a little difficult now.
Yeah. But you're doing it in different ways. You're doing it in different ways by giving back to, and I think that's also the.
No, it's like a donor identity for life, for sure.
Yeah.
Well, I would add to one of the things that you said though about being proactive.
Yes.
And as a primary care physician, you can only do so much. At some point, the patient has got to do their job as well.
Yes.
And when you talk about not talking about your illness, there's a measure of that. I don't want to acknowledge what's going on. And when both Dale and I, once we did this or found out it was possible, we need a urine sample. Well, I carried the jug around and, it was like, let's go. And then it's like, we need to do the blood sample. When can I go? And so there was a measure of, we're going to do this. Let's just go. And I would suggest to people who might be feeling ill, or they might think they need help, make the phone call. And when somebody tells you something, if your doctor says, hey, you've got some levels that we need to send you to a nephrologist, you need to go.
Right, jump.
Because there is a measure of logistics here that are a challenge. We can't just, when you get sick, schedule you for next week and go do it. It's logistically a challenge. And that's the one thing that I try to tell people. It's like, hey, they've told you you're sick. Let's go. Get up and go. And the most successful outcomes I've seen are the people who take matters into their own hands when it's what they're supposed to do.
Right.
And regardless of what your illness is, in today's world, in today's healthcare, you have to be your own advocate.
Yes.
And, it is great to have people supporting you and fighting for you. But like you said,
If you don't get up off that floor and do it, if you don't put it out there, no one else is going to do, no one else
can. And so you do have to show up for yourself. And that's a big, working in mental health, that's a huge thing, learning to show up for yourself.
I was going to say, and you're worth it.
Yeah.
Yes.
And you're worth it. And that you can get through the depression. You can get through the fear. You can get through the anxiety because it's powerful.
What do you, I can only imagine there's so many everyday lessons, but how have you incorporated your experience as a donor recipient to the work that you do in mental health?
All the time. It's on my website, that I'm a kidney advocate. It's a story that I tell. It's when I'm, if there's an area where I can relate it to family participation or family involvement or wellness or being willing to accept help. I may not have, psychosis, or I may not have a cocaine problem, but I did have a very serious mental illness that I was deathly afraid of. And the word deathly was what was going to kill me. Yeah. Right. And so when you look at addiction and mental health, they have a deathly fear. And that those illnesses, can be just as deadly. So I bring it into all my work. This episode will probably be on my website. I think it's if you're in healthcare, you've got to encompass all of it, but mental health touches everything.
Yes, it really does. Since you donated in 2007, and again, it seems like it's this ongoing identity. Correct me if I'm assuming, but do you just continue to incorporate kind of this identity for yourself and your work with your family? You bring so much awareness, obviously, to kidney disease.
No, an odd thing. I am always willing to do what I can when anybody, but I forget. And I think sometimes that's what I try to tell people who are wondering. I've done 2 half Ironman triathlons. I've done multiple sprint triathlons. I remember one time I thought, hey, I'm going to go do boxing to get in shape. And my wife said, no, you're not. And I'm like, why not? And she said, you have 1 kidney. And I'm like, oh, right.
Oh, yes.
So that to me is the thing.
Right.
It's like when the subject comes up, I'm like, here's the thing. But my life is completely normal. I'm just like anybody else when it comes to health. I forget sometimes. I was sitting here going, you got to be proactive. And I remember I'd gone to the doctor, got my blood work. The staff called me to give me the blood work. I forgot to call them back. So they called me later in the day and said, hey, you've got to call us. We've got the results. And I'm like, so I'm as forgetful as the next person. But that's, I think, my narrative is I forget.
You forget kind of physically.
Physically, I forget. And sometimes I will look in the mirror and go, oh, wow, you've got one.
Oh, okay.
But I just want to maybe kind of live my life in service if I can. But I think I try to be that anyway.
That's what I was going to say. I mean, it seems like there's just an enduring spirit of giving, though, in service. I hope. I hope. And maybe that was always there. I didn't know you before.
There are times when I, if I have, when I go to the doctor and I have a physical something and they say, I say, hey, well, by the way, I have one kidney. And they go, oh, well, we should have known, we needed to know that. I will say I don't take anti-inflammatory medicines.
Okay.
But there's the jury is out on that one. I've had nephrologists say if I would let you take anti-inflammatory medicine with 2 kidneys, then I don't mind you taking anti-inflammatories with 1. And then there are others who say don't. So I just choose not to. Yeah, yes. I choose not to. Okay. Yeah. I think that's just we can have a different discussion on that one. But
we'll take that offline.
Yeah. I also try to stay hydrated. But other than that, I feel like I live my life the same way I did before.
Yeah. You're thriving.
With 1 kidney because it grows.
Living it better.
And Annette, you're thriving.
Yeah, I'm thriving.
Yeah.
By God's grace and Diana's grace.
Yes.
Yeah. I've met a bunch of awesome people because of it. That's the way I've always looked at it.
Me too.
I am surrounded by some of the most amazing people I never would have met.
Right.
Because of the community of donation.
Because you're both vital members of that community.
Yeah. Whether it's this organization, whether it's Donate Life One Legacy, it's really an amazing.
You always show up, Philip. You always
shows up.
Every time I call him that we're having this event, we need you. He says, "When is it? I will be there."
Amazing.
Well, it's also because he calls me 3 years in advance.
Yes.
So it's
that's not true. That's not true. We've been last minute. Can we get Philip? And the answer is, if he can make it possible. I mean, he has a life, a wife, children. But if he can make
family.
it,
yes, I'm sure,
make it possible, he shows, and that is core. Philip is an embodiment of because he's one of the founding members. People he leads by example.
A real ambassador.
And
it's awesome because I see all the same people there. So
And you too, Nanette. Is there anything else about CORE that we want to share with our audience too?
One thing to the audience is, you saw Philip and what difference he has made in somebody else's life, society, and everything else, but also in his own life, right? So what I say to everybody is that if you're interested in learning more, right, there are resources, and there's no better resource than Core Kidney. Whether you're talking to Philip, Brian Gillam's name was mentioned. There's so many, kidney donors that 1 year out, 5 years, 10, 20. So get to learn more. And I think it was you who said that, Nanette, which really left an impression on me, that if you have an opportunity to help somebody, right, why pass that up?
Right? All that we give to ourselves.
And I think that is such a powerful statement, right? If you can help somebody, why pass it? And that's what CORE is about. And these are 2, examples what CORE does. I'm very grateful, like I said, Philip, and I'm speaking on behalf of Nanette as well, that you're a super angel, and thank you for all that you do.
And he's a great fundraiser too.
Yes, yes.
For many organizations.
Right.
Yeah.
Well, I think maybe I'm an example of others in that. Yes, after having become a living donor, it's like you can't donate again, really, but you can tell people the experience.
Yes.
And I think there's a lot of questions that people might have.
Right.
We go to an event and somebody is like, well, I was thinking about doing this, or I just did this, and what about this thing?
Sure.
And that's when you can give again.
Yeah, it's ongoing giving, for sure.
And the understanding, and I don't know what time we have, but I remember sitting in the Connie Frank Center, which is the kidney transplant center at UCLA, and there was these 2 young Hispanic boys, and I say young, they're probably mid to late 20s, right? Both of them on dialysis, and both of them were new kidney recipients. And one of them was showing, I was on dialysis for 7 years, and he had, the things that changed, the fistulas, and the other said, well, I was 9, and, I did dialysis at 3 a.m. because I had to go to work because my mother was sick. And what I know, I have family that are of the Latina community. What I know
About the Latina community or Latino community, you said we have to be male, female, but if they knew, if aunts, uncles, grandparents, if they knew they could donate to those boys, what a difference it might have made in their lives to 7 to 9 years of dialysis to doing that. And I think it's about education and awareness, because there's so many beautiful communities
that are very family centered that I know would show up if they had the information. So awareness is so key. Education is so key.
So key, which is
And
so
that's why
great while you're
programs
here.
like this are so key, Dr. Glazier.
Yeah.
Oh, 100%.
I mean, these are such amazing programs that you and your team are putting together.
Oh, no, are you kidding? We're so honored to just
No,
have this
it's
platform
it's
to
getting the message out
share.
in a way that people can understand. I mean, I've heard your podcast, and they're really. I mean, even
like I'm turning it around.
But it's
You learn from the best.
But these are things that we need to get out there.
Yes,
right?
absolutely.
And that's where the UCLA Healthcare is involved.
No, and then that your example is very well taken, because we do so many wonderful things at UCLA Health, and we need to bring them to the communities where people are all over Los Angeles, if not further.
If they only knew.
That's right. That's right.
If they only knew, these things would be different.
And that's on us to share and educate.
And that's why we have to continue to show up for what was yours, 2007 you donated?
I think so.
And you received yours in 2020?
2022.
2022,
Just
so
3
still
years.
during.
So, he's 20 years in and still showing up every time.
Yeah.
So I want to be that person.
Yeah, I'm sure that you will be. I could
know
not.
she will be.
I mean,
and since we're thinking of things that we want people to know.
Yes.
If I could speak to somebody who might be listening to this and they're wondering if they wanted to or not, the one question that I always get is, well, what happens if I get sick?
Yeah.
What happens if I need, or if
it's the
my
next question.
family member does or doesn't? And there's two parts. That the one that the doctors told me at the beginning was that in general, kidney disease will attack both of your kidneys at the same time. So if I have kidney disease in the future, it would have gotten my kidneys anyway. So having one or two, but the personal thing, because this question was asked of me by a person who was considering donation, and they said, what if your child needs a kidney down the road and you don't have it? And I said, but what if she doesn't? And that was the thing for me.
Because of the here and now is what I was worried about. I can't worry about the future. I said, what if Dale dies
and the family member never got sick? So that was my thing. So I did look at it logically. I did ask the questions about what would happen to me, and the me part I felt like I answered from the scientific element, which is I have a chance of getting sick.
you're at the top of the list.
Oh, really?
But as a
You do, yeah.
as a donor, you don't go.
But they also said anecdotally, there's not a lot of research been done, but they said kidney donors live
Right.
longer. So it's an interesting thing that
Because they're healthier.
Yeah, because
Right.
they stay healthy.
Right.
and
that's
they're
where all
healthy
that
to
screening
start
comes
with.
in.
That's
And
right,
so I asked the questions about what happens if I get sick in the future, and I felt I got those answers.
Right.
But the one about what if somebody in your family needed it later, that was the one that, for me, I was like, yeah, but what if they don't?
Right.
And what if you can save a life now?
Yeah.
And a family. And just going back to that, there are other programs, and UCLA Health has been a leader and is a leader and doing a lot of innovative stuff. So we have a voucher program in which you can donate in advance, and it's basically a voucher. So somebody wants to give, then it doesn't need, or somebody in our family, but they might need it eventually. So somebody can donate on their behalf, and they can put, multiple people's on the name that, this one, and they'll be on that list. So if they ever need, they get. So that's a voucher program.
We have a member of CORE that
did that. Yep.
did that.
There is also the paired exchange, and I think that's very important.
Those are
because
amazing.
In the in the past they would ask, "Am I a match?" Well, you don't have to be a match.
Wait, what's a paired exchange?
So paired exchange is, suppose Philip wanted to donate to Nanette, but they are mismatched. Their blood group is not compatible. Their thing. But Philip can donate to somebody else, and that person can donate to. So they match it up, and a lot of times you get a better kidney, so there's better matching. So what I tell,
and this can happen with 9 to 10 people.
I think
30
people.
Biggest
was
multiple.
90. The biggest chain was 90.
And it doesn't happen immediately necessarily.
Yes.
It could
Incredible
be,
matrix.
yes.
Yeah,
Yes.
it just
Yes.
goes on and on.
But
and on.
it's like a potluck,
Right. I was going to say,
it's
the best chain letter ever.
Gives
Yeah.
on my behalf, and I get on someone else's behalf because they get too, and so.
No, you're right. Potluck. It's great.
It's a kidney potluck.
I love it.
But
and
also why you call core. This is another
Yes.
reason you call
Yes.
core, because
Right.
they can say, here's your answers.
Yeah.
Another thing that core does that I've experienced myself is not just with kidneys. So you have this advocacy, you have this case management team. Part of my disease didn't go away because I got a new kidney. I still have an immune system disease, polycystic kidney disease. So I have other complications. Well, I needed to be able to see another provider, and the list was very long, the wait, and I couldn't wait. Well, I have an advocacy in core to help me get through that.
Right.
And to help me get a resource in the time that I need it. So it's beyond kidneys.
Yes.
It's that social work part. It's
And
that
centered on
advocacy
you.
part. It's that research
In your
part.
family.
Yeah.
It's amazing.
And just going back to the blood group, because a lot of people ask, "Can I be a donor?" and says, if you're healthy, you can be.
Because there's lots of ways.
The blood group is not a factor anymore.
Right.
This paired exchange will take care of it. The other is, which is still a smaller group, but it's called non-directed donors. We used to call them, by different name in the past.
Altruistic.
Altruistic donors. But non-directed means that you don't know who's getting the kidney. Somebody will benefit from that. So these are all very, very powerful things that UCLA Health is a leader in immune tolerance, programs that are going on. So and UCLA Health has always been known for transplant, not just kidney, the heart, the lungs, the liver, bone marrow, gut, So it's really a very, I would say, inspiring place to work at, and working with people like Philip and Nanette. It's for us as healthcare providers, and you being one as well, and a very good one. I think we feel good, right, when we see this kind of passion about craving. So I'm very grateful to both of you, and spending your time with us right here and sharing your story, because we did the Rose Parade float, and somebody twice. And the only reason why we didn't do this here is because we had a lot of other things that we had to do. But somebody asked me.
Let's talk about the kidney center.
Yes, yeah. But let me. Somebody asked me, what is the purpose of the float, right? A lot of people want more business. A lot of people want the name, right? And I told them, and which I truly meant, if there's a person sitting in Mississippi, and they see Philip and Nanette going by, it gives them hope. And that was if we can make a difference in one person's life, right?
Yes.
It's a success. And that was the purpose of the floats.
Yeah, it's that old saying, right? When they say, you're walking down the beach and you throw one starfish, and they say, why are you throwing one? There's 1 million here. It doesn't matter. And you're like, it did to that starfish.
Thank you. Yeah.
So
like the pebble that you spoke about initially.
Everyone matters.
Yes.
Right. There's so much just shared humanity in this amazing community.
Amazing.
I can't thank the three of you enough. Is there any just last minute kind of takeaways or final reflections just for the audience? I mean, there's been so many, but I just need to hear your voice one more time.
Be brave. Reach out.
Brave.
Be brave. Reach out. There is help. There is hope, and it's there and available, and you deserve it.
Thank you so much.
I would say that you never know who in your life has a desire to help. That may be their prayer. And if you don't give them that chance by talking to them, then they're missing out and you're missing out. So share your story, and you never know what you might get back.
It's beautiful. And Anjay, last word.
I mean, I would just say that humanity is alive and kicking. That's all that I would say.
Well, and you're leading the charge with these with these podcasts. So thank you
thank
so
you.
much.
No, I could.
And your
We couldn't
team.
be luckier. We have the best team, and we couldn't be luckier or more grateful for the three of you being here. And I mean, not just sharing your story and your perspectives and reflections with us right now, but just really everything that you do every day. I mean, it's just incredible. And I mean, I think that these are beautiful stories, and I know marked by so much like hardship that we're not even talking about, and or you've alluded to. You know what I mean? But it's. Kidney donation isn't simple. It's not casual, and it's not that you've represented it that way at all. But you're both doing so well and thriving. But it's not something that anyone does lightly. And then just hearing how thoughtfully, just how ethically, just the support from the core program. I really think that just you and this story that you're sharing really represents humanity and medicine, at their best. And I'm just
joining.
Very, very grateful. For our listeners, we'll have a lot of information in our show notes and links to the core kidney program. I'm sure a lot of people are very curious and have a lot of questions, and so we'll have a lot of resources about transplantation and kidney health. We'll reference back Andre's other episode, which is very informative.
Remember, medically, I know nothing, so always go with whatever they
medically speaking, Philip. Medically speaking, Philip. I think you got
medically speaking, you guys are the experts.
Thank you so much, and thanks for everyone for listening. And we'll see you next time.
Thank you
both,
so much for
all of
having
you,
us.
so much.
Thank you.